Hi, everyone. My name is Catherine Fritz, and I'm calling from Washington, D.C. I work for the International Center for Research on Women. And for those of you who are familiar with the Strive Learning Labs, welcome back. And those of you who are new to them, we're really pleased that you've been able to join us today. Just a quick word about Strive. We're a research consortium that's funded by UKAID, and we include partners from India, Tanzania, and South Africa. And we're really focused on all of the social and structural drivers that are driving the HIV epidemic. In particular, the one that I've been working most closely with is on alcohol and HIV. And as you may know, Strive is divided up into working groups. And one of them is those of us who are taking a particular interest in finding interventions and collecting data that will help elucidate the connections between alcohol use and sexual risk behavior. And so we were really pleased to find out about Monica Swan's work. Monica is a professor of epidemiology in the School of Public Health at Georgia State University in Atlanta, and she's with us today. We found out that she's doing some work that is extremely parallel to research that we are also doing as part of Strive. So we wanted to take an opportunity to hear more about her interesting project in Uganda that really focuses on the connections between young people's drinking behaviors and how that's shaped by their exposure to alcohol, marketing, and advertising. So that's it from me, and I'll just turn it over to Monica, who will speak for a half hour, 40 minutes, and then we'll have some time for Q&A at the end.
Good morning, good afternoon, good evening, everyone. I'm just very thrilled to be here. We are very excited that we have gotten a 2-year planning grant from the NIH to do this preparation of this structural intervention to focus primarily on delaying early alcohol use, as well as impacting the link between alcohol use and HIV among youth who live in the slums of Kampala. Given that I only have about half an hour, I still thought it was very important to give you some context. You know, why are we doing this work in Uganda? I want to share with you a little bit also about the needs of our target population, given how limited information is available about them. Then I want to guide you a little bit through our thinking about this structural intervention, our conceptual plan, our project team, the data collection efforts that we have underway, some preliminary strategies and some preliminary data. Also spend some time on challenges and next steps, in particular your questions and suggestions. So we really want to make sure we do have time for that. Pretty much all of you know that HIV is a pressing problem in Uganda. There are lots of campaigns, to try to reduce the incidence and transmission, and there are lots of messaging that may not be empirically based. The prevalence of HIV in Uganda is much higher than the regional average. When we focus on young adults in particular, 3.7% have HIV. Now, when we look at the target population that we're working with, and that is youth in the Kampala slums, over 10% of them report being HIV positive, so very high numbers. So what about alcohol? Much less is talked about alcohol in Uganda, but it is a substantial problem. This slide comes from the WHO Global Status Report on Alcohol that was just released a couple months ago. This measures alcohol per capita consumption among those 15 years and older. So it looks at average consumption in the last couple of years versus more recently. And while recorded alcohol, meaning commercial alcohol that is captured, stays about the same, the unrecorded alcohol use is actually going up. So unrecorded is also referred to as non-commercial, or the types of alcohol that aren't typically bought and sold in registered systems. But the key point of this slide is that the total alcohol consumption in Uganda is actually higher, much higher than the regional average. So there's also research about alcohol and HIV, in particular from other parts of the world, that have identified adolescents in sub-Saharan Africa as one of the most important high-risk groups for HIV, given the high levels of the epidemic there. But one of the issues in this region and Uganda specifically that have not been captured is really the role of early alcohol use in HIV transmission, particularly through unprotected sex. So we know, of course, from extensive research in other parts of the world that adolescents who use alcohol are much more likely to be sexually active than non-drinkers, and those who drink heavily are more likely to engage in unprotected sexual intercourse. So there are several reasons why alcohol use is an important risk factor for HIV. Another part that is not well studied in Kampala is also alcohol marketing. There's extensive marketing over there. There are very few limitations and regulations on the industry or those advertising, and so that's one of the pieces that we're very much interested in as well. So a couple years ago, in 2011, we did a study with the target youth that we're interested here, the youth who are living in the slums of Kampala, and we did this in collaboration with the Uganda Youth Development Link, and I'll introduce them in a moment. But in that research, we were particularly interested in youth levels of alcohol use, exposures to marketing, their level of education about alcohol use and prevention, and their levels of problem drinking and drunkenness. And what we found was some really interesting marketing strategies that the industry and merchants were engaged in. So, for example, there were high levels of obtaining free alcohol, even for those underage. The study population here were 14 to 24 years, but even for those under age 18, which is the legal drinking age in Kampala, getting free drinks was quite common. And we found that getting free drinks was associated with problem drinking and drunkenness, even when we looked at other important factors. So from that research, we concluded that there is a need, for more research in this area, but also for policy-level intervention and structural interventions that seek to reduce this problem. We also did, from the same study, we also looked at some issues related to correlates of positive HIV. I'm not going to go through this in great detail, except to highlight where I have provided, some indicator of the significant findings. And it's really just to underscore that a lot of the risk factors for HIV in this population is being an orphan with both or two parents already deceased, drunkenness, and expecting to die early. There's lots of needs in this population. When we look at alcohol and sexual engagement in HIV, drinking alcohol prior to sex is very common, either by the participants themselves or them reporting on behalf of their partner. So if you look at this pie chart, and you look at the orange section here, which is almost 66% or 65%, that's the proportion of both partner and the participant drinking at time of sex. So it is a very common problem, in particular to unprotected sex. So just to sort of give you an overview of where we've been with the research that we've done over the last 5 or so years, we find that the youth in the slums of Kampala have very high unmet needs on a range of issues. There is a great sense of social isolation, loneliness. They come from fragmented families, which is one of the reasons why we think that structural intervention is particularly important. There are very high levels of exposure to alcohol marketing. There are much higher prevalence of sexual intercourse by less condom use than school-attending youth. We've done several comparisons with these youth to try to quantify in what way they might have more high-risk behaviors. We have also found that drunkenness is highly associated with HIV, which I just showed you. And there's also a high prevalence of drinking at time of sex and also high levels of HIV. So for all these reasons combined, we find that a structural intervention is really probably the best way to address these issues. So moving on to sort of our conceptual approach for a structural intervention for youth living in the slums of Kampala who are ages 12 to 18. We want to collect quantitative and qualitative data to increase our knowledge base. Before we did some of our research, we found that there was a very scarce information about these youth in the scientific literature, and so I'm really eager to get a better understanding of what their needs and prevention strategies may be. We also want to integrate technology and spatial analysis and data collection, in particular as it relates to alcohol marketing, because that really hasn't been done in this part of the world, and we think will really inform our intervention. We also want to engage an international interdisciplinary team. We want to analyze data and seek feedback from stakeholders. And we want to design an empirically informed structural intervention. And, of course, then after we've done this, we want to implement and evaluate the intervention. Now, there are some important theoretical frameworks that we can build our work on. This is an ecological perspective, and this particular model is developed by Scribner et al. in a paper published on HIV risk in the alcohol environment. And what we like about this one is that it does bring in the societal and neighborhood levels. And we're going to be working with this type of model and expand it so that it can fit in the situation and the needs that we have. So this is sort of the loosely framework that we have at this point as we're gathering data and developing this. So now to our community partner collaborator. We have been so fortunate to meet the Uganda Youth Development Link, or UDEL for short. They're a very large NGO in Kampala. They operate about 6 drop-in centers. And at these drop-in centers, youth can come in to provide or be provided with mental health, substance use counseling, health clinic referral and screenings. But they also get skills and vocational training that really helps them, in positive development and for job opportunities as they're leaving the centers. But the UDEL also, they advocate for youth. They're very engaged in policy development, and they have fantastic leadership in the executive director, Mr. Rogers Kasiri. We're very thrilled to have them as one of our partners, our key partner. So we have a core team here at GSU, and again with UDEL, but we also have community psychologists and geoscientists involved in this. Of course, I have several master's and doctoral students who are also part of this. But I think what really strengthened our project here is that we have consultants from all over the world. So Dr. Nazarius Tumwesigwe, for example, he's a biostatistician at Makerere University in Kampala, who helps us with some of the analysis. We had Dr. David Jernigan, who is one of the foremost international experts on marketing all over the world. We have Dr. Isidore Abote from Nigeria, who is really well recognized for his alcohol and substance use work, not only in Africa but elsewhere. And we have Wim van Dalen, who is a champion for alcohol policy development, who is based out of Netherlands. We have Anne Gamarova in Kampala, who has led multiple campaigns for different health causes, and we really hope to benefit from her expertise on the ground. And we have Josephine Okama, who is the director of another NGO who deals with youth living on the streets and in the slums. So that is our team, and sort of that's where we've been. And I'm going to transition here into the data collection that we're doing. We have been doing some environmental scans of alcohol marketing around each of the 6 UDEL centers, and I'm just going to spend 1 minute on the next slide to go over what that means. Most of our work is related to the youth survey that we did earlier in the year, and I'm going to share with you some preliminary data from that. We have also done some focus groups, and we're going to continue to do focus groups as we analyze the data and want to have that additional component and clarity of the next step. We are also involving NGO leaders and are actually in the middle of a data collection from a survey to ask them about their input and resource needs for conducting this type of intervention that we're trying to structure. And we're going to do focus groups with them as well in December to get more insight from them about what their priorities and how we can collaborate. So a quick word about the environmental scan, because that's probably the most or the least understood part of our project. Environmental scans have been done on all kinds of topics, but I have not really seen them done in Africa in this particular context. If you look at the slide and you look at the round circle, there's a small little red X that you might have a hard time seeing. But the little red X is one of the UDEL centers. So we are very interested and asked our participants on the survey how much alcohol marketing they see. We were also interested in how much marketing we could see by walking around the neighborhoods where they spend a lot of time. So the little red X in the middle of the circle is the UDEL Center. We drew a 500-meter radius, hence the circle, and we had a team canvassing these neighborhoods to see where the marketing is. So each of the numbers that you see, the 007, the 015, et cetera, are what we call locations of various alcohol marketing exposures. So we have taken pictures of the marketing, we are labeling the marketing, we are looking at whether there are warnings for underage drinking, et cetera, on those, and really trying to complement that with what the youth have reported to ourselves. To the right, there is a picture of one of my students, and this is where we want to highlight sort of the technology integration. In her right hand, she's holding a Garmin, a tool that is used to get the GPS coordinates so that when we're walking around the neighborhoods, we can actually get the GPS coordinates. She has a notographer around her neck, which takes pictures continuously so that we do have a good record of the alcohol marketing. And she also has a logger that actually keeps track of where in the neighborhoods we have been. So that's sort of one of the technology aspects of this project. So a little bit more about the survey that we have done, because I think most of the messaging that we'll be developing for this project is based on the survey we did. Earlier this year, in March and April, we set out to do a survey of youth 12 to 18 years of age who came to the UDEL centers for services. And, of course, the goal here is to describe the behaviors from their own experiences. We were able to actually secure tablets to administer the surveys, and they took just about 30 minutes to do. We had a very high participation rate, but we had some technical issues and lost some data, which was very unfortunate. But the project was approved by both our local IRB as well as the Uganda National Science. The survey that we conducted was used measures that had been used previously in surveys like the Youth Risk Behavior Survey that is done in the U.S., as well as the Global School-Based Student Health Survey that is done internationally. But we also included measures from different alcohol monitoring, different surveys that have been done all over the world. And like I said, we used electronic tablets, and our social workers who administered the survey and our participants really loved doing the tablets, which was fantastic for us. In terms of participants, we had, 44% were boys, 46% were less than or 16 years of age. 41% of participants used only one room for sleeping, even though they have very large families, to indicate, again, these are families in the slums. 22% of the youth have lived on the streets. 22% are orphans. And we had a good distribution across Christian and religious faiths. So we have a third Christian Catholic, a third Christian other, and 25% Muslim. And we really wanted to capture this because we know that has an impact on drinking behaviors. In terms of sexual initiation and risk, we found that about half of the participants had ever had sex. 42% had had intercourse prior to age 14. 37% did not use condoms with their partner in the past 3 months. And 14% engaged in commercial sex work. So in terms of HIV-related concerns, like I mentioned before, more than 10% reported that they had HIV. 67% know how to use a condom. 56% did not use condom at time of first sex. 46% reporting having sex with 3 or more partners, and 17% haven't been raped. So I'll just illustrate here to you a couple of the, their patterns and their exposures and some of the trauma that they've had that really all are likely to exacerbate, the risk for HIV transmission. Also, when we look at drinking at time of sex, which is one of those risk factors that is most likely linked to not using a condom, we find relatively high levels of drinking before time of sex and also partner drinking before sex. The prevalence goes down a little bit when we talk about drinking heavily, but drinking at time of sex is very common in this population. So age of alcohol use initiation is another important domain, since we're very interested in reducing the timeline of when they initiate. So we find here that the modal age is really 15 to 16, which tells us that if we're interested in delaying alcohol use, we really need to do that much earlier. So what about the drinking patterns and preferences? Well, we find that 50% drink 2 or more times per week. Nearly half of them obtain alcohol from a friend. 73% drink alcohol with their friends. Only 17% find it hard to buy alcohol because of their age. And remember here, the the legal drinking age in Kampala, Uganda, is 18. Now, 26% prefer drinking alcohol in sachets. And if you don't know what sachets are, they're small little clear plastic bags that are selling individual packaging of alcohol. So the picture to your right, see a lot of these bags just stacked on a shelf so that they can come and just get a little plastic bag of alcohol, which tends to be much cheaper than buying it any other way. 31% of our participants prefer locally made alcohol, some of that which is non-commercial. So one of the parts of this project that we're really interested in is their exposure to marketing. And this is just one snapshot, if you will. We have lots of different forms of marketing measures, but we were interested in, are they watching TV? If so, do they see actors and characters on TV drink alcohol? Do they see alcohol brands advertised on TV? Do they see it in magazine and ads? Do they see it around town, in particular billboards? And are they exposed to other people drinking? And so we see relatively high levels of different types of marketing strategies. What are we doing in terms of next steps? Well, we're completing the recruitment for the NGO survey and focus groups to really get information from the people who are doing this kind of work, because we are envisioning this intervention that we're about to design to really be conducted in partnership with NGOs on the ground. We're considering redoing the environmental scans. I didn't give you any data on that in particular, but we're also wondering if we need to capture we made an assumption that the youth would really spend a lot of time around the UDEL drop-in centers where we recruited them, but we also found that in some of these centers they really didn't spend much time there, and so we're more interested in getting exposure data from where they spend more of their time. We're going to continue to do focus groups for the youth, again, to message test and to get more clarity from them on some of the empirical data that we're busy analyzing right now. We're going to continue analyzing the data and integrate findings. And we're going to initiate intervention development. Again, how do we develop our message themes and testing, campaign branding, determining the intervention scope and the intensity, determine the feasibility of potential policy and enforcement strategies. We need to look at community engagement strategies as well as evaluation metrics. And, of course, we are continuously building partnerships for this work. One of the goals of this learning lab was also to present on our challenges. and there have been many, but I've been trying to pick the most salient ones and those we really hope to get some input on. We've had some technical difficulties. We lost some data. There were some server changes when we're trying to upload the data, so hopefully that won't happen in the future, but it did set us back some. Another key challenge has been the limited map availability in Kampala. Kampala is not a city where people, there's a culture using maps in the same way we might in the U.S., and so we have been trying to be very resourceful and trying to have that geospatial component to this project, but there's something that we're still trying to work out. Another challenge is how we best integrate findings across informants and settings. So I've told you we're collecting data from youth, from NGO leaders, from these environmental scans. So then how do we integrate these in the best way with the strategy of coming up with this intervention? Then, of course, there's very much unique needs among these youth that we're serving. There are low levels of literacy, there are huge language barriers, and in addition to that, very high levels of isolation and fragmented networks, which is, again, why we think a structural intervention is the best way to go, but given their high needs, we're also trying to figure out how to best serve those. In Kampala, too, there are limited policy changes and support for different enforcement. So, the extent to which we can actually incorporate that remains to be seen, and I'll talk about that in the next slide as well. So in terms of our conceptual challenges, we're also debating, we had initially set our goal here to focus both on delaying alcohol use initiation as well as alcohol-related HIV transmission. But we realized, too, that there might be very separate types of messaging, very different types of structures, even though they're overlapping. And so we're trying to tackle whether that is the best strategy or we would be better off separating these. So that's something that we'd be really interested to hear your perspective on. Another conceptual challenge is that while there's been a lot of research done, say in the North America, in Europe, in Australia, about different evidence-based prevention strategies at the community levels, in particular for alcohol, the extent to which we can really apply or borrow from those and, for the Kampala environment is really questionable, just because the infrastructure is very different, the policy environment is very different, and again, there's really no enforcement at all of underage drinking. The other part that we also find as a challenge, there is so limited research on structural interventions for alcohol and HIV, period. There are very few of us working in this area. So while it's really exciting and sort of an open area, it also is more difficult because there's not much to draw on in the same way, which is sort of why we all need to partner and collaborate. And then, of course, most importantly, perhaps of all, is that, how do we devise, this type of intervention and create a compelling case for future funding? We always have to be mindful that finding is a key part of being able to do this work. In particular, for those of us in the U.S., we have to make a compelling case, not only why this is important on the ground where it's meant to be implemented, but what is the benefit to the U.S. It's just the funding environment has become much more difficult, and so it's just something that we have to keep in mind. So at this point, I guess I'll hand it over to Catherine for questions and suggestions.
Thanks, Monica. That was really, really interesting. And I just was saying that it's so nice to hear from another team that's grappling with, the same issues that we have been as well. And certainly we'd like to learn from each other in terms of especially thinking through these issues with youth. So we're going to open it up to questions. Maybe I'll just start it off by asking if you could just flesh out a little bit about the policy environment in Uganda right now in terms of what the general content is of their alcohol policy, if they have one, or, how it addresses youth drinking, or where you kind of see some of the policy implications of your work in terms of filling gaps in the evidence that might be helpful for government representatives or policymakers to know about.
Thank you. I'll start with that. So there's been some movement in policy development in Uganda. The UDEL, the Uganda Youth Development Link, they have really been pioneers in moving that forward. They have produced several policy documents and have had several sort of stakeholders meetings. We actually had one earlier this year in June where I presented some findings and when they talked about the needs in the communities. interestingly, the minimum legal drinking age is 18 in Uganda. There wasn't a preliminary, mystery shopping or a protocol, if you will, where they tested whether anybody would actually check anybody's drinking age. And as part of that protocol, nobody was ever stopped from purchasing alcohol. So there's an incredibly lax environment in terms of the minimum legal drinking age. The policy piece that I saw when I was there earlier this year was that it was actually being introduced into Parliament, a preliminary discussion about increasing the drinking age from 18 to 21, which was an interesting one given that there has really been no enforcement whatsoever on the drinking age of 18. And so I'm not really sure what the context of the political environment was for that particular initiative. It just seemed that just might not be the best priority. So there is not much enforcement. The industry regulates itself. There's lots of advertisement. And I was thinking about putting in some photos into this presentation, but it could almost be a presentation all on its own in terms of the alcohol marketing environment, where there's tremendously large billboards next to schools, next to kindergartens. So the type of prevention strategies or policy and legal environments that we see in other countries is simply not followed. There's a huge amount of exposure. So I think that there's some interest, and there are people pushing for stricter policies, but I really don't know if that's, if that's more a 5-10 year plan, if that, at this point.
Great. Yeah, that's extremely helpful. Thank you. I had one other question. In the publication that you sent, it talks about the sort of gifts and promotional items that are given to youth in the community. What's the kind of mechanism through which that happens? And how is the alcohol industry, how do you feel they are actually targeting impoverished youth? For what sort of purposes, especially given that obviously this is extremely poor. I'm just interested in the interplay between the industry and this particular community to the extent that you can comment on it.
No, we are fascinated by this ourselves. And so to the rest of the audience who may not have had a chance to look at the paper, what we're talking about is promotional gifts and gadgets, if you will, with logos on it, whether it has Nile beer on it or something else. Because the research shows that if you have those type of promotional items, that if you weren't drinking, you're more likely to start drinking, or you're more likely to become a heavy drinker. So we find it really puzzling that these youth, right, we are working with, who have, who live in such grim poverty, that the reach of these type of products really reach their hands as well. And so we are puzzled about how that works, and that's actually going to be one of the theme of our focus groups that we're going to do later this year. But these youth, they don't spend all their time, in the slums. They're quite mobile, or at least this is what we're speculating, which is one of the reasons we're interested in doing an environmental scan with, more precision of actual where they're spending their time, so we can take an inventory of the alcohol retail outlets, where they are, and how that works. But the other part of your question is also that, there's much more promotional type events, by the retailers of alcohol, where they would set up sort of a little stand, if you will, and hand out these little trinkets, promotional products in a way that I don't think that I ever really have seen it in the U.S. or have seen it in other countries that I have visited. So there's this constant promotion, if you will, that really, I guess, penetrates even to these communities, which, like I said, it's difficult to understand, and which is why we're fascinated by it and really need to understand more.
I'm interested, of course, in the findings on sachets, and it's interesting to note that some of the young people who took part in the survey said they preferred, the sachets. Mm-hmm. And so I had two questions. One is, okay, so was this spontaneous, or was there a question that specifically asked about the sachets, or did it just come up? And then two, in terms of here in Tanzania, we are also interested in issues around packaging and pricing. So in terms of, if you look at the adverts here, you don't see a lot of them. There are a lot of adverts, big billboards, I think similar to what has been described from Uganda. But then it's very rare to see the sachets advertised in those billboards. So it's normally beers and these kind of alcohol packaged in larger quantities. But it's very interesting that young people apparently are very much using the sachets and the influencing the drinking norms. So I think is that the same in Uganda?
So I don't really know. So the first question about how the sachets, how we added that to the survey, that was, that was specifically requested by Udell, our partner, because they hear people talk about the sachets and, that it's very common when they talk about the youth and where they're buying their alcohol, they tend to buy the sachets. So they're very popular as a way to buy alcohol, in particular for the youth with limited amount of resources that, they may just get enough money to buy, these small single-serving sachets, which, I've not really seen outside of Africa. This is sort of a marketing/packaging strategy that the industry has pursued with the concept in mind that people have less resources. But your second question, and I think it's really interesting, I've not spent enough time in Tanzania to really, say how this compares, and I really can't comment on that. I think it would be very interesting to look at it given, how close the countries are regionally that, one would imagine that there are some parallels, but I really don't know, but I appreciate your question.
We have another question that's come through the chat from Avalon de Bruyne at the European Center for Alcohol Marketing. And she says, thank you for this wonderful presentation. Do you have any figures concerning the amount of free drinks that alcohol producers give potential new customers?
No, I don't. So I think it's a really critical question, isn't it? But to get these numbers either from the industry or from, I don't even know how we would go about getting it. It would be fantastic to know because I think, one can approach this on so many levels, right? It's not checking someone's of legal age to drink, but you can also talk about sort of human rights piece, social justice of this, meaning that the, retailers, industry is pushing and marketing their product to people who aren't even legally to consume it. So I would imagine that it'd be very difficult to get numbers. I've been trying, I even talked to David Jernigan about finding sales data in this region, and it's just very difficult to get a better understanding of the specific numbers.
Yeah, that's very interesting. And that seems to be a place where some ethnographic research could be quite helpful in terms of just watching how and when this is happening to record it. We have also a question from Doug Endall at Forut. Has there been any attempts to regulate sale of sachets? If so, how is the industry responding to regulations? In other countries, we see that producers try to come around regulations by changing packaging materials or volumes.
So as far as I know, the only place I've seen the recommendation against the sale of sachets has been in the policy documents that the Uganda Youth Development Link has been, spearheading and championing. I think there's been some regulations in other parts of Africa, but I've not seen that implemented, and I don't think that that's coming up anytime soon. But I agree with that comment that chances are, if it is there and if there's not sort of the policy environment to support it, there will be just, new and different strategies for packaging.
Do you get the sense that policymakers are really thinking about these issues in terms of the hazards to young people? I mean, I get the impression that obviously it's easy to kind of get people backing to around the issue of not selling alcohol to young people, even though that's not enforced. At least most people agree on that. But do you hear, in the policy world in Uganda, people talking about giving these free goods or free drinks or marketing to youth as part of the youth and alcohol question?
Yeah, I don't. I think that the alcohol as an issue has not really been framed as sort of a public health problem that really needs legal and policy development. I think it's just not been a priority. I think there's been so many other urgent situations and health needs that alcohol has really fallen to the back seat, and which is very unfortunate because it is so linked with other infectious diseases and with other needs. So it seems to me that because of that, it really could step up and be a higher priority. But where I'm sitting and what I see, it has not gotten the attention. So because of that, these specific strategies, whether it's sachets or whether it's the marketing, none of that has really, gotten hold, which again, why the Uganda Youth Development Link is really trying to push this very hard. But no, this is one where it's going to take a village to get something done.
Are there any champions in the government? I know my recent experience has been in Namibia, where there's one particular person in the Ministry of Health, for example, who's really championing this issue and pushing it forward. Is there anyone like that in Uganda?
Well, it was interesting, and just because you asked now, I lost the name of the commission. There is a commission who works, like I said, I can't remember what their name is, but they actually have purview of like the large billboards in the roundabouts, in the circles in the city. So while they don't have sort of restrictions on alcohol per se, they actually, as of the last couple months, have required that large billboards, and we're talking enormous ones, like, New York Times Square size ones, for those of you who have been there, like enormously large billboards. And they said that they had apparently violated some legal issue that had been put in force, years ago, but no billboard should be that large, downtown within the city of Kampala, because they were too large, they blocked the view, etc. So they have taken many of those down already. Now, I've not visited since June, but when I was there in June, many of them were coming down. Now, they weren't all alcohol, but I think, a huge proportion of them were. And so that was a setback, I think, for alcohol advertising per se, although that initiative wasn't directly for that. But that was I think, a fantastic initiative.
Well, that leads us to another question from Doug, actually, who says, do you have any preliminary ideas about which structural interventions would be most appropriate in this setting?
So we have a couple of ideas. I mean, we are really framing this as going to be a counter-marketing campaign. So we really, are taking an inventory of the ads that the youth are seeing, the messaging, and how they relate to it. And we're really trying to focus on this counter-marketing campaign. But in addition to having sort of posters and flyers and ads that may be both on the radio and TV, and we have to sort of look at the best, cost-benefit for those kind of things, we're also thinking about incorporating a hotline. We're incorporating sort of town hall meetings and engaging the community. And so we have a couple of different prongs that we're actually looking at. We're also looking at your work, Catherine, as well as the work that's been done in South Africa in terms of server training and engagement with the retail community. That I'm just not sure how effective it can be in the absence of enforcement, from the legal system, from the justice system. But we are exploring all of those to see, what might be the most appropriate in this particular setting.
Another question from David Kalema, who says, this is commendable work, well done to the research team. What's the time frame of this research, is one question. And another is, the research focuses on most vulnerable youth in slums in Kampala. Are there plans of extending it to rural areas for a more balanced view?
And so the timeline for this research is, as I was outlining a little earlier, is that we are trying to collect more pieces of data. Like I said, the youth survey is done, but we're going back to do more focus groups, and we're also engaging with the NGOs, and we're looking into the environmental data, the environmental scans we already have conducted. But we hope that in this next year that we'll have written and analyzed and really have gotten to talk to you so that we have the intervention developed, within this year. So before next summer, we hope to have it all ready to go. And I would love to do it in rural areas as well. I just don't have as much familiarity with it, but I think that is a very important question. And I would imagine that there are equally grim needs among the youth in these rural areas as there are in the city. It's just that the environment might be different. So absolutely, and David, if you want to talk after this, I'm glad to entertain ideas for other locations for doing this as well.
Hi, thanks for the really interesting presentation. I was reflecting on the comments that you're making around the structural interventions and the interventions that will be focusing on young people themselves. I think mindful of the fact that without any policy level interventions, it's going to be very hard for community groups and funded projects to tackle a very strong alcohol industry. But regardless of that, I was thinking about the structural side, and particularly the comments with the research that young people, particularly young people, I think it was particularly young people living with HIV who'd been talking about the different reasons for drinking, among which were, or maybe it was young people in general, comment about going to die early. And I was thinking about that sense of building support networks and resilience amongst young people who are clearly living in incredibly challenging, difficult, and personally complicated circumstances, and how much you feel your interventions are going to be looking broadly at those socio-economic issues, providing broader support, young people living with HIV, for example, access to, wasn't clear whether many of them are accessing care and treatment, whether they're in adherence support groups or connected to any kind of psychosocial support networks. And so I was interested to look at it from that perspective, and whether there are partners within the HIV response who could be taking on more responsibility for now that we see these results on the issues related to alcohol, whether there's more responsibility that could be being taken to integrate some of these issues into more general HIV programming.
So thank you, Joanna. So lots to your question, right? The layers there. So let me start with what's not an easy one, but the easiest one to address first, and that is, your very perceptive comment about their social isolation and, I don't even know what to capture this, but they're very concerned about how long they're going to live. And so this kind of mental distress or, anguish and social isolation absolutely needs to be part of whatever intervention we're doing, because I think if one doesn't have the willingness to live, right, there's no intervention that's going to be effective in terms of changing behaviors and condom use if there's not sort of a plan and hope for the future. So I think you're absolutely right. That is absolutely something we need to do something about. And, in our work with the community partners who are working in these parts of town in Kampala where we are working, we're absolutely reaching out to the HIV prevention community and treatment and all that to make sure that these youth are taken care of. But it is an environment with very scarce resources, and UDEL as a community-based organization does not provide treatment themselves, but they do have partners. Actually, they have some funding from the UK to link up with, screening and referral and things like that. And so that network is really increasing and has been a really huge priority, and we've seen some substantial progress this last year. So I'm hoping that can all be part of it, because I agree with you. I think it's very, very important.
Calling in from the WANSA team. One last question. May have missed it, but was wondering if there was information on where these youths are drinking. We were talking about some of the policies in the underage drinking of the 18, that if the youth are drinking outside of the pubs or in private, then that policy of 18 years wouldn't necessarily find them. So I was just wondering if there was information on where exactly they were doing the drinking.
No, and I think it's an intriguing point, and this is something that we've been pondering as we've been, like I said, trying to take an inventory of where, the alcohol retail outlets are and where do these youth spend their time. So we know that they don't have a problem buying alcohol. Like I said, only 17% of them find it hard because of their age, and so there's nobody stopping them if they want to buy it. And then most of them drink with their friends. So our sense is that they're just hanging around where they usually go, not necessarily in drinking environment, not in retail establishments, if you will, to drink. But this is also another topic for a focus group that we're going to do this fall to really get a better sense. Because, again, if we're going to do posters and flyers and, sort of these counter-marketing messages, we obviously want to make sure that they will get placed, where the drinking occurs. And so I agree with you. Fantastic question. I just don't know.
We also had a comment from Doug who says that his Sri Lanka partners have developed methods to challenge people's alcohol expectations and notions, similar to what you do when you challenge notions of harmful masculinities. Such interventions combined with policy enforcement seem very promising. There may be experience and ideas to borrow from there, bearing in mind that methods have to be adapted to cultural realities. Be also a topic for future learning labs.
Oh, well, thank you, Dag. I will send you an email or see if I can find those directly if they've been published. Would love to read that and see what they have found.
One thing, Monica, that you didn't touch on in this presentation, but I know that you have a lot of expertise in studying violence as well. Mm-hmm. Strive is engaged in research on several structural drivers. One is alcohol, of course, but then also violence against women is another. We're just, thinking through ourselves some of those interconnections, and I'm just wondering if you had any observations from your fieldwork so far.
So thank you. Well, I have to say that, I'm trained in violence prevention. It remains a passion of mine. We included a couple measures of violence into this survey, but not as much as I would like to. And we also asked about violence, among our Kampala youth, in 2011 when we did that work. And so it seems that there are very high levels of violence, and it's so interconnected between, exposures in the family. We're talking rape, we're talking to commercial sex work and the risk that, is related to that. The alcohol and HIV and the gender-based violence to me becomes really interlinked. And so I think it is a substantial problem. When we talk to the youth in focus group settings, they always bring it up. And so it seems to me that it's something that comes to their mind almost sometimes even before they think of alcohol as a risk factor for either violence or for HIV. So it's something that from a very cognitive, it just rolls off their tongues and they talk about victimization and brutality. And so I think it's something that we really would like to do more with. I was really intrigued by the SASA study that came out a couple months ago about a structural intervention to deal with, gender-based violence in some of the communities in Kampala. I thought it was a fantastic study, very elegantly done, and really wanted to see more about how they set that up and how they were so successful.
Well, we can also help you make those connections as well, because Charlotte Watts, who's one of the PIs along with Saidi Kapiga for Strive, also was very involved with that study with SASA. So, yeah, we're as well interested in making those connections. There are fewer of them than one would expect, or fewer people doing research in that area, perhaps, than one would expect.
But I thought it was very intriguing and very much needed.
Yeah, absolutely. Just to say that for everyone that we have these Strive Learning Labs every month, and we try to have a whole variety of topics that address the different structural drivers that Strive is working on. And if you have suggestions for folks you'd like us to include, please do send them to Annie Holmes. But otherwise, also this Learning Lab has been recorded, and we do have a growing library of Learning Lab recordings that's available on our website. So we do encourage people to go there and listen to old presentations, or also share this presentation with other colleagues that you have. So Monica, thank you so much for lending your time to speak with us today, and I'm sure folks will be getting in touch with you as well to find out more, and we look forward to keeping in touch and learning more about how your project is going, and we'll tell you more about ours as well.
Thank you so much. I really appreciate the invitation and this opportunity to reach a worldwide audience who are interested in these topics as well. And I really welcome suggestions and follow-up via email. That would be fantastic. Thank you.